Most people looking for a hair transplant are primarily focused on graft count and will often compare clinics as they make a decision on where to go based on this number, multiplied by what the clinic charges per graft. But should this be the primary metric by which you decide where to go for a hair transplant? Or are other variables more important than the number of grafts? The truth is, there's a lot more to hair transplants than the graft count alone. In this video, I'll explain the most important factors that lead to amazing hair transplants that hold up for decades. These core 4 factors include patient selection, safety and graft survival, design, and execution. There are 5 key items under patient selection. The first is hair stability. It's always important to make sure that a patient's hair is nice and stable before jumping into a hair transplant. Remember that hair surgery, like any surgery, is controlled trauma to the body. And when you have hair that is actively falling out and shedding, if you come in with a hair transplant, you might accelerate the loss of the hair that's currently there, defeating the purpose of the actual hair transplant. We want a good stable foundation that we can build on when doing a hair transplant, rather than a moving target that's difficult to predict how exactly it'll change as time goes on. The second is good donor density. You need to have a sufficient amount of donor hair that you can safely harvest and move to the new location and not completely deplete the donor supply. Because if you are depleting the donor heavily, you're essentially creating a different kind of alopecia pattern. The third is sufficient hair loss at the recipient area. I'm always looking for enough hair loss to justify the hair transplant, because some patients come to me and say, hey, look, Dr. Linkov, I've noticed a reduction in my hair volume. It's not like it used to be. But I look at them and I say, I believe you, but you still have a great head of hair. It looks quite full. That's not a situation where I want to come in and place a lot of grafts in areas where they still have lots of hair. That's usually not a great approach to doing hair transplants, partly because you can injure the existing hair that's currently there, and also because you may not see a sizable difference with the transplanted hair, and it might be a waste of grafts in many ways. Number 4 is good overall health. There are various medical ailments that might make it so that the transplanted hair doesn't grow well, or where your healing is heavily impeded. That could be conditions like uncontrolled diabetes, or significant thyroid problems that lead to poor wound healing, or blood thinners that make it unsafe to do the surgery in the first place. The 5th is probably one of the most important variables, which is realistic expectations. We want patients to have a good sense of what they'll likely get, and we don't want people to have overinflated expectations, because that can significantly contribute to disappointment after surgery, which is definitely what we look to avoid in cosmetic surgery. So that's why I try to add realistic comparative images to my gallery so people can really see what's changing with the actual hair transplant, rather than lighting conditions being completely different, or angles being difficult to interpret, or someone in the after image having like fibers in their hair, for example, making it look much thicker. That's going to give unrealistic expectations to people, so when they get their surgery and they don't get quite the result that they saw online, they might be significantly disappointed. The next core factor of what leads to excellent hair transplant results is safety and graft survival. This bucket also has 5 items that I wanted to touch on. The first is proper disinfection of surgical instruments. Some of the items used during surgery are disposables, like gauze for example, but others are actual surgical instruments that get autoclaved and properly cleaned to allow them to be used on other patients as well. If that processing cycle isn't done properly, and if the instruments aren't well sterilized, well then you run the risk of higher rates of infection in the practice, and that's a scary thing. So as we try to keep patients as safe as possible, having very good sterilization processes and doing things like spore testing of your autoclaves is extremely critical for making sure we keep people safe for these elective procedures. The second thing is keeping lidocaine at safe levels. Most of us use lidocaine with epinephrine during surgery to A, reduce the pain and discomfort of surgery, and B, clamp down on the blood vessels and reduce blood loss and increase visibility during our procedures. But lidocaine in high dosages can be lethal. So that really is the number one biggest risk of a hair transplant. So it's very important for the surgical team to be careful with how much lidocaine they're administering to keep that very safe. And I have a video on risks and complications of a hair transplant where I discussed safe levels of lidocaine, so make sure to check that one out if you're interested. The next item is keeping inflammation down during surgery and after surgery. We do that in my clinic with the use of prednisone taken as a pill right at the start of surgery and with injectable Kenalog that we place into our tumescent solution. And that's part of the solution that gets injected in the areas where we work. That helps to bring the inflammation levels down. That makes it safer for grafts so that they survive at a higher rate. And also it helps with post-op recovery so people don't get as much swelling in the healing phase. Item number 4 is preventing grafts from drying out. The number one thing that leads to poor graft survival is grafts getting too dry. So making sure that grafts don't spend much time out of the body, like just laying there on the scalp all dry or laying there on the finger as the team is trying to implant the grafts, trying to reduce that time is going to maximize graft survival and lead to improved hair transplant results. Item number 5 is manipulating grafts with care. Performing a hair transplant is done as a team effort, and every member of the team that touches grafts needs to do so carefully to try to minimize any damage to the graft. If a graft is handled roughly in the way that it's loaded into a DHI pen, for example, or the way it's manipulated with a forceps placed into a pre-existing recipient site, if that is done in a rough manner, it will reflect in the ultimate outcome. Core factor number 3 is design, and this factor has 3 items that I wanted to touch on. The first is the artistic vision, and something that could be seen as controversial, but I'm just going to go out there and say it, is that I believe that artistic vision cannot be taught. I think that it's something that each surgeon either has or doesn't have, and same goes for technical help. The entire team could have potentially really great artistic vision and feed off of that and optimize the beautiful artistic hair transplant result for the patient, or they could be lacking in that artistic vision, and that will again reflect on the final outcome. And I think when you look at someone's gallery, if they have enough examples for you to evaluate, you'll start to see their artistic vision and how they design hairlines, how they can create naturality to the direction and angle of hairs to make it look like it fits with the hairs in the surrounding area. Item number 2 is understanding what nature looks like and knowing how to recreate it. As a surgeon, we need to understand what a whorl is, for example, where it usually is located in the crown, how a hairline exists in nature, and how it changes as we age. And we also need to have the skills to recreate that and to make it look like it was always there. And item number 3 in the design bucket is taking into consideration future hair loss, because we know that even with proper medical therapy, people can continue to lose hair to a degree. So we need to design our recipient areas in a way that could account for future hair loss and also the number of grafts we use, making sure that we leave some in the reserve in case we need to come back and add to it, or if a new area opens up. So that's very important. Medical therapy is going to be very important too, but understanding design from the standpoint of anticipating future potential needs when it comes to hair transplants is very important. And if you're interested in artistic hairline design, make sure to check out my video dedicated to that topic. And the 4th core factor is execution, and this one has 6 items that we need to touch on. The first is mimicking hair angle. The exit angle of the hair is how exactly it comes out of the scalp as far as its angulation from the surface of the skin. It can come out at a very acute angle, such as let's say 10 to 15 degrees if we're talking about the temples. It can come out at angles closer to 90 degrees sometimes when we're talking about other areas of the scalp. But classically at the hairline, for example, we're looking at angles of about 30 to 45 degrees. And that angulation usually increases as we move back along the scalp. At the whorl, for example, in the crown, reception, we almost always have a perpendicular exit angle, and recreating that is very critical for natural results. The second is the direction of the hair. So there's angle, but there's also direction. You can have the same angulation, let's say 45 degrees, right, in how it's exiting the skin surface, but the directionality could be different. It could be pointed this way, it could be pointed this way, and that direction will change as you move around the scalp. And usually those directional changes are gradual, so making sure to recreate that with the sites that we make for the transplant is very, very important. The third is being able to extrapolate to areas without hair. So it's one thing if you're working in an area that already has some hair and you're basically trying to increase the density. But what if you have a recipient area that, at least in part, has no hair? You need to see what is in the vicinity as far as the angles and directions are concerned and try to recreate that. It's almost like generative AI with our brains. It's that fill-in feature that we're trying to do as we do this type of work. The fourth is having the proper depth to our recipient sites so that the graft is not so deep where it starts to sink in and you can get pitting that occurs, and you also don't want the site to be too shallow where the graft isn't properly seated and it might not survive. You want the grafts to be peeking out just slightly above the level of the skin so that as it heals, that graft starts to be on level with the surrounding skin. The fifth is irregularity and patterning of the grafted region. Usually you want the grafts to have a staggered type of pattern where it doesn't look like they're completely in these even rows, because that's not how hair exists in nature, right? So being able to create this type of staggered design and having enough irregularity built in is what leads in part to very natural results. Number 6 is reducing scar formation in the donor areas. Most people around the world have transitioned to FUE surgery, follicular unit extraction, where we punch out individual grafts. Now every single punch is going to lead to some form of a scar, and safe harvesting has to do with minimizing that scar formation, and that's related to the types of punches that are used. It's related to the accuracy of the person harvesting in trying to minimize transections and trying to really optimize the number of punches that are made to the number of quality grafts that are extracted. You don't want to get 2,000 grafts by punching 3,000 holes. You want to be able to get as close to that 2,000 holes as possible to keep that transection rate low so that you're reducing the number of scars that are created to get the number of grafts that you want. And using punch sizes that are too big is of course going to lead to worse scarring. And having those scars be too close together is another problem. And harvesting more grafts than you need is also going to give you potential issues. With these core 4 factors being equal, then graft count matters, not before. Otherwise, you get lots of grafts that are poorly placed, destroyed donor areas, regrets, bad reputations, and the list goes on and on. But even graft count has its nuances. For example, coefficients matter. These are the number of hairs per graft on average. Remember that grafts exist as families of 1 to 4 hairs. Most grafts will have about 2 hairs, but sometimes they can have a single hair and sometimes they can have a family of 4 hairs. So when people talk in terms of grafts, they're usually not specifying what the actual coefficient was. For example, was the coefficient for surgery closer to 2? Maybe it was even under 2? Or was the coefficient closer to 2.5 or even closer to 3? That is going to change the density that's created in the recipient area, because essentially you're getting more hairs into the area, not just grafts. So if you did a 2,000 graft case and you used all single hair grafts, that's 2,000 hairs. But if you did a case where for the most part you had an average of 2 hairs per graft, well, now you have 4,000 hairs. That of course is going to give you a more significant result. And a higher coefficient is usually achieved with a larger punch size, so that you could potentially get more density with fewer grafts. But of course, if your punch size is too big, then you get worse scarring. So it's always going to be a delicate balance. And a lower coefficient is achieved with smaller punches, and less density is usually created. In addition to the coefficient, other factors also play a role even with the same number of grafts, and that includes hair caliber. Thicker caliber hair is going to look more dense. Also, hair type. Curlier hair is going to look more dense than straighter hair. The angle makes a difference as well. More acute angles look more dense than when the angle is more perpendicular. And direction. Hair that's following the same direction is going to look more dense because of the shingling effect compared to hair that's going in different directions. So if I have a patient with thicker hair that's more curly and it has flatter angles with the same directionality of hair, that person is going to get a more impressive visual result compared to someone with thinner, straighter, more perpendicular hair that is changing directions. I know that I'm not the right hair transplant surgeon for every patient, but the people who've done extremely well in my clinic have shared some of the same characteristics. These are people who care for quality and an artistic touch. They desire high-level care with strong physician involvement. They have a long-term vision for optimized hair aesthetics, and they want a natural, aesthetically pleasing outcome. Remember, graft count is just part of the equation.